bones, the flat, the irregular, and the sesamoid. Is this where we left off?
Yeah.
Okay, I thought so. And the sesamoid. Each named once again according to their shape. And we're going to break each of these down individually and give some examples of all of them as well. Now, I will not be able to give all the examples, so please go back and look in your Merrill's book and cross-reference what we're talking about. Make sure you look at what all the examples are of the bone classifications. If I give you every single example, we'll be naming bones all day. We won't finish this chapter because there are over 200 bones in the body. You can't name them all. But we will name those common examples. So long bones, that's going to be the ones found primarily in your limbs. And that's when we're talking about the upper extremities and the lower extremities specifically. Those are all your long bones. Two most famous examples being the femur and the humerus. And they're classified by having a body and two enlarged ends. If you remember, that body part is going to be called the diaphysis. The two ends are called the epiphysis. That is the main characteristic. It has a body and two enlarged articular ends. Most famous examples being the femur and the humerus, but not the only ones. You've got the radius and the radius and ulna, tibia and fibula. You've got the clavicles. They're also considered long bones, and many other examples found throughout the body. Your fingers would be long bones as well, or phalanges if we use the scientific term. Now, that femur is very, very important because what's that characteristic of the femur? It is the largest and strongest bone found throughout the human body. Why? It's got to hold all that weight on top of it. Helps us to walk around. So the femur would be the largest and the strongest bone found throughout the human body. And the next category is going to be what we call our short bones. Why are they called short bones? Well, they're very small and short. Most famous example being the carpal bones. What are the carpal bones? Those are the bones found within your wrist. You are going to fall in love with those carpal bones because I'm not going to let you forget them. Why? Because the registry loves to ask about all 8 of those carpal bones and have you label them. Now, another example besides carpal bones would be the bones found in the foot that we'll call the tarsal bones. Those are also short bones. Now, what's their main makeup? They're made of cancellous bone and they have a thin outer layer of that compact bone. So you'll see it's different from the long bones. It doesn't have the 2 articular ends. It doesn't have the elongated body area. They're very small, but they have various shapes, as we'll see in those tarsal and carpal bones whenever we start breaking those down next semester. They have very unique shapes to all of them. They're characterized by that cancellous bone and that thin outer layer of compact bone. I remember what I was going to say. I used to watch House all the time. I used to love that show. But you'll find the thing that's really aggravating is as you work in healthcare for a while, it ruins those shows for you. As you see too much stuff that stands out that's wrong, and they say things wrong, they do things wrong. You just can't ever watch it the same way.
Yeah, and House is one of those where I could watch it for a while, then I have to kind of take a break, like as well, and then I'll get back into it. But I definitely get that.
I like the Sherlock Holmes aspect of it. You're always trying to find out the mystery disease. But yeah, you start seeing all kinds of stuff that's wrong in those shows, unfortunately. Another, while y'all are writing, another example is latest thing I saw that drove me crazy was on a Marvel show. Anyone watch the Disney Plus Marvel shows? Like WandaVision, you ever seen that one? There's a scene in that show, I love the show by the way, but there's a scene in that show where they're doing a CT head scan on a patient, but they're using a portable x-ray machine. I'm like, man, that's an advanced portable x-ray machine. I can get myself one of those. And it's not even one of the new digital ones. It's like an old school machine, like with cassettes. Like, wow. Go back and watch it and see what I'm talking about. Get a chance.
How dare you?
All right, next we have the flat bones. Why are they called flat bones? Because guess what? They're very flat in their shape. Two most famous examples would be the sternum and the bones in the cranium. Sternum and the bones in the cranium. They have a middle layer of cancellous bone that we call diploe. Another example that's not listed there would be the scapula. The scapula is also a flat bone. So scapula, sorry?
That's the scapula there, right?
Where?
The D picture?
That's actually a vertebrae.
Vertical. Oh.
It's a T vertebrae. That's what we're coming to next. That's going to be our irregular bones. Why are they called irregular bones? Because all of them have a very distinct, unique, irregular type shape, just like this vertebrae we see right here. So examples would be your vertebrae and your facial bones. The bones in the face are all very distinctly shaped, very unique. They have irregular shapes to them. Every one of these bones we're going to learn inside and out. They all have numerous landmarks we have to name as we study all these different parts of the body. You'll know all you want to know about that vertebrae and all you didn't want to know about that vertebrae by the time we're done. You'll know even more than Dr. House on the show, and whatever that other doctor's name is. Patrick Dempsey, I just know the actor's name.
Shepherd?
So they'll be saying, oh, that patient has fractured their spinous process, and you'll be like, that's not a spinous process, that's a navicular bone. What are they talking about? That's a greater tubercle in the humerus. It's not a spinous process of a T vertebrae. It's going to drive you crazy. You'll see what I mean. If it sounds good on a TV show, they figure most people don't know what that means anyway. See, and you can really impress your family because, you know, your next big holiday gathering, you hit your elbow, you can go, oh, my olecranon process. And everyone's going to be like, what? My olecranon process. Oh, my intertrochanteric groove. It's lots of fun to do that to your family, trust me. I do it all the time. Maybe I'm just a nerd like that. But. Then we have the sesamoid bones. The sesamoid bones, named because they are very small and oval. I always call them the sesame seed bones because they look like little sesame seeds on the x-rays. You'll never forget it that way, by the way. They develop inside and beside tendons. They're actually attachment points for those tendons and ligaments. And they protect the tendon from excessive wear. And you can actually develop sesamoid bones throughout your life. Like if you use your hands a lot and you get a lot of friction in your hands, you'll develop extra sesamoid bones, extra attachments for those tendons. Same for your knees, your ankles, your feet. Sesamoid bones can actually develop anywhere on the body where there's a lot of friction happening in that particular area. Largest of those would be the patella. Another famous area will be the area of your thumb. Almost everyone has a sesamoid bone near the thumb or the first digit. A lot of people have extra ones around their other fingers as well. By the way, do you know that you have 1 thumb and 4 fingers? You don't have 5 fingers. It always blows people's mind when I say that. It blew my mind when I found out. People always say I have 5 fingers. Actually, you have 4 fingers and 1 thumb. Everybody know that already? Some of you knew that already? I had an argument with my teacher once about that. So I was like, no,
So my
it's 5
question to you
fingers.
is the thumb a finger as well?
It's a thumb.
Thumb is a thumb.
Thumb's a thumb. You have 1 thumb, 4 fingers, but you have 5 digits.
My
Not
friend
confusing
just
at all,
said
right?
that, and I was like, son, you have 5 fingers, he's like,
No, that's just that'll be next. That's next semester. We're jumping ahead. I'm just throwing extra facts up there for
Is that
you.
because the thumb isn't considered a phalange?
What's a phalange as well? It's just I don't know. Some
It's
person in the English
unique.
language is having so much fun with that.
So
Maybe some people are wrong.
the sesamoid part is here, or?
Sesamoid part would be right here, most commonly, at the joint attachment. All right, which of the following of these 4 choices is an example of a flat bone? I believe I gave you this example. D, the scapula. What would those other 3 be classified as?
Femur is long.
I want y'all to get used to doing this, by the way, guys. Y'all see what we just did there? We named the correct answer, but we also classified what the other 3 were. Now, why is that important? Because you may inadvertently answer another question on your test by doing that. Always look at all your choices. Don't just take that one correct answer. Look through all of them, analyze them, and you can answer another
So
question on your
radius is
test.
also long and clavicle would be the
Clavicle is
short-
considered a long bone
also
because of the
long.
shape of it. Yes. People often miss that one and don't realize they usually call it a short bone. But it's actually considered a long bone. So I would put a star by that because people miss that all the time. All right, all the following are functions of the skeleton except what?
Production of minerals.
All the following functions
I'm hearing all kinds of answers here.
A lot of E.
Did someone say E? Is that the mystery answer?
I think it's B.
The one we'll make appear here in a second? No.
Oh, no, C.
It would be C, the production of minerals. C, production of minerals. And which of the following can be palpated to locate T7? What's an alternative way to find T7? We learned
You
about
said the jugular notch, you said for the obese people.
the jugular notch. The jugular notch, very good. So the normal way would be what? What's the landmark we're going to use the normal traditional way on the back of the patient? What's that called?
The vertebral prominence.
The vertebral prominence is the normal way, but an alternative way would be that jugular notch. Now, it doesn't say that in the question. It says, which of the following can be palpated to locate T7? Now, I don't see vertebral prominence, therefore the only other correct answer would be jugular notch. You see how I did that?
The vertebral notch is not the T7.
The what?
Vertebral
Vertebral
notch.
prominence is not T7, but it's how we locate it because we put our fingers like this. And you guys
So-
are going to practice
I
that in
see.
lab
It's the-
tomorrow.
Oh, I see.
Yes. Yes. You guys are going to practice that in lab tomorrow. All right, let's go to arthrology. So we're going to learn about our joints next. And arthrology, there's your definition right there in red. That's the study of joints, articulations between bones. And we classify those joints in two ways. We have what's called the functional classification and the structural classification. This is the study of arthrology. And we're going to break down all those famous joints that you're doing all the way back from A and P, such as that ball and socket joint, that hinge joint, things like that. I put that picture there because that's how my seniors feel about joints right now. If you guys can go review it. Some joints just really give them a nightmare. Also, the old textbook they used wasn't very good at explaining it. All right, so we have three subdivisions. This is based on the mobility. How's that joint move? So we have what's called synarthrosis, amphiarthrosis, and diarthrosis. Please put a big star on those three terms. Know what they mean. You're going to see them used a lot in different types of questions. So synarthrosis means it is an immovable joint, a joint that does not move at all. Amphiarthrosis is going to refer to a slightly movable joint. Then, of course, diarthrosis would be the freely movable joints, as most of our synovial joints fall under. Screen's working. We're going to give some examples of each of these. Next couple slides. Anyone off the top of their head just name an immovable synarthrosis joint? I just gave you a clue in what I just said. Anyone caught that? No one caught what I said there?
You're talking about your synovial joint, but that's the diaphragm.
Who's mine? Immovable synarthrotic joint. Any
Immovable.
examples you can think of?
Immovable.
Immovable. Immovable. Does not move. Yes. The cranium, very good. See what I did there? Can anyone name off the top of their head a synarthroidal immovable joint? Correct, the cranium. The sutures in the cranium, because we obviously do not want those moving around. If your cranium is shifting around and moving around, you might want to get that checked out. That should not be happening. But we'll talk about that here more in a second. So we have also three distinct groups based on what we call the connective tissues found in those joints. So the first three categories were based on movement. These three are based on the connective tissues. We have the fibrous joints, cartilaginous joints, and the synovial joints. Synovial being the ones that you use the most, because that's what helps you move around. Now, when it comes to the synovial, or all joints, actually all the joints together, we have 11 specific types of joints that fall in all three of those categories. We're going to name all those in just a second here. Most famous ones again being those synovial, which I believe you learned these all the way back in elementary school, if I'm not mistaken. But we're going to hit all those once again. So fibrous referring to a fibrous connection. Cartilaginous is talking about a cartilage type connection. And then synovial is referring to what we call a synovial fluid filled capsule that surrounds those joints. And one thing that we do a lot in radiology is we do what's called arthrograms, and you'll be assisting with these, and they do little injections in those joint spaces to check the integrity of those synovial joint cavities. and make sure there's enough fluid, enough padding, that joint's working properly. You guys will be a part of a lot of those. All right, so fibrous joints, that's the first category we're gonna go over. These do not have a joint cavity, they're completely sealed, and they're united by fibrous connective tissues and ligaments. They are also the strongest joints found in the entire body. So once again, one example we already named that's also an immovable type joint would be the bones in the cranium. The sutures of the skull are what we call fibrous joints. Also, this joint right here on letter A is what we call the distal tibiofibular joint. It is also a fibrous joint. And then C, one that people often forget about, is actually the area where your teeth connect into your mandible and the gums. That is also a fibrous joint. Obviously, that's another joint we don't move it around. If your teeth are jiggling around, not a good thing, unless you're a kid and you're losing your teeth. We want those to be completely sealed and non-movable in the mouth. Now we have three categories of fibrous joints. We have what's called syndesmosis, suture, and gomphosis. That's a mouthful. Say that 3 times fast. Syndesmosis, suture, and gomphosis. So once again, one of those fun words that you can throw at the dinner table. I'm chewing with my gomphosis joints. They'll look at you like you're crazy, but one of those fun words to use. No one has fun with words like me? I guess I'm the only one.
Among the third connective, the three tissues that were connective tissues, fibrous, cartilaginous.
Fibrous, cartilaginous, and synovial. All right, so syndesmosis joints, that's going to be that one particular joint we just named, that inferior or distal tibiofibular joint. Make sure you write inferior and distal, it's used both ways. It is immovable or slightly movable, united by fibrous sheets. The sutures in the skull, once again, are immovable joints found only in the skull, and the gomphosis joints being those immovable joints found in the roots of the teeth. There's going to be our three categories of fibrous joints. One is slightly movable, which what was the word for that? Slightly movable? Amphiarthrodial. And then we have two immovable. What was the word for that? Synarthrodial. So see how we have a lot of overlap there, that terminology. Like you can use in conjunction with each other.
So that the syndesmosis one was inferior and distal?
Only the distal inferior, because the proximal superior actually is fully movable. Good question. All right, next category are cartilaginous joints. They do not have a joint cavity either. So those first two categories, the fibrous and cartilaginous, they share in the fact that they do not have joint cavities. They are virtually immovable, and we have two categories found on the cartilaginous joints. We have the symphysis and the synchondrosis joints. And there's two examples right there in those pictures. Most famous, not the only one by the way, but the most famous of the cartilaginous joints is the pubic symphysis. Very important joint for our mothers out there. And it needs to be slightly movable. Why? Why would that be so important?
For the baby to
For
come
the
out.
baby to be able to pass during birth, correct? So just cut you? And of course, what do you think the synchondrosis example is going to be based on those pictures? If you were to wager a guess. First example is up here. The growth plates, correct. That's just a fancy way of saying those growth plates found in pediatrics, synchondrosis.
Which one,
There we
which
have
one was
it.
the psychondrosis, sir, among the two pictures?
Say again?
Which one was the psychondrosis among the two pictures?
Right here with the growth plates, the pediatric growth plates, or epiphyseal plates. And that's what we're going to name right there, guys. So there's the symphysis. That's a slightly movable joint. Once again, why is it slightly movable? To allow passage of the baby, and also for posture. Separated by a pad of fibrocartilage, and it's designed to absorb strength and, it's designed to absorb shock if you were to fall. And once again, it's not the only symphysis joint, but the most popular, most famous is gonna be that pubic symphysis. Then the cychondrosis is an immovable joint, completely immovable. That's gonna be our epiphyseal plates as children or as pediatrics. We have cartilaginous joint, cychondrosis joint. Yes.
So, I know that we're not necessarily able to move it possibly anymore, but the tailbone, is that considered anything at all?
Tailbone. Ooh.
Synthesis?
Oh, tailbone. Don't. We got to work on our terminology here. Never say the word tailbone again.
Sorry.
The coccyx, yes. I just had to point that out. There's now the coccyx in your vocabulary. We don't call it the tailbone. Doctor's gonna laugh at you. What was your question again? I'm sorry.
So, like, is there a growth plate that used to be there in between the coccyx?
Yes, actually, there's a lot of cartilage found between those little. What's the word I'm looking for? Little coccygeal sections.
Okay.
It's actually separated at birth, and you'll see it begin to fuse into one single bone as you get older. Yeah, good question. A lot of the vertebrae are very separated as a child as well, which you'll see in a lot of pediatric x-rays.
Is that why they're so flexible?
Is that why they're so flexible? I don't know why they're flexible. It's just part of growth and development. Yeah. Because you remain pretty flexible. Well, not all of us are very flexible. I'm
I
not very
meant with,
flexible
like,
anymore, but
with regards to like how much bone mass they actually have, like they just lift more fluid in that sense.
not exactly.
No?
No. All right, that last category is going to be our synovial joints. And we'll spend a little more time on this one, guys, because we've got a lot of subcategories of synovial joints that we have to name. These are going to be what permits our wide range of motions. It's how we move our arms, our legs, our bodies, our spine, our neck. Almost every area of your body which is pertaining to movement is going to be a synovial type joint. They're very complex, and they're enclosed by what we call an articular capsule. That articular capsule is filled with synovial fluid, thus the name synovial joints. And then there are what we call accessory soft tissues called the meniscus and the bursae. Do not worry about memorizing this diagram. We'll come back to that in Rad Pro 4. That's just showing you those two types of soft tissues we're talking about. So you don't have to worry too much about all this until you get into MRI and CT. But we will do a review of that in Rad Pro 4 when we talk about arthrograms. But that's just showing you that capsule right there. That is the knee joint, of course. There's your femur, there's your tibia, there's your patella. That synovial joint space is right here between the two bones. Now, why is that so important? Not only does it allow a lot of movement of the body, that's how I can bend my legs and bend my knees, but what else do you think that serves a purpose for, off the top of your head?
So the bones won't rub on top of each other?
Say it again?
So the bones won't rub?
Very good. So the bones won't rub on top of each other. So bones can actually erode each other if that synovial capsule or that synovial membrane is compromised, wears away through excessive wear and tear and age. That's why a lot of people will get joint injections to replenish that synovial fluid. Imagine this is all gone. These bones are just going to grind on top of each other and cause a lot of pain and actually cause a lot of wear and tear and really mess up all your joints.
So
Yes.
is that why a lot of people get knee replacement?
Yes,
too?
yes it is.
Okay.
Yes it is. Very good.
So synovial fluid must try with age. It's a compulsory thing.
Well,
Like, for everybody does.
It's not, it's kind of just random between people. And a lot of it has to do with like how much wear and tear, like how much of physical labor you've done. That can actually, what's the word I'm looking for? It can actually speed up the process of losing that joint space and that fluid, but it's kind of just random. Just genetics, things like that. Yeah, yes.
Oh, it's genetic. I thought, is that what do you call arthritis? Or
Arthritis?
Arthritis?
Arthritis, yeah, that's like a swelling of the area. Yeah, we're going to get to that.
Oh.
Yes, yes, good questions. So, here is our 6 major categories of synovial joints. A lot of these should look familiar from A and P. From back in grade school, we have the gliding joints, the hinge joints, the pivot, the ellipsoid, the saddle, and the ball and socket joints. You probably think off the top of your head examples of all those, but we're going to break them down further on the next few slides. We'll give you a few examples. Once again, this is not all the examples, but the major examples of these types of joints. So please go back in your book, cross-reference the different joints that fall in these categories. You doing okay out there? Y'all still with me? Oh, it's early. Almost to that first coffee break. Hang with me. What's probably the most famous ball and socket joint, guys?
Hip.
That shoulder, right? That humerus connecting to the shoulder, to the glenoid cavity. Why? Because it looks like a ball into a socket, as you see right here. Ball and socket, you get it? They didn't think too hard about that one, did they? It looks like a ball going into a socket. Ooh, ball and socket joint. All right, so the gliding joint. The first one we're going to talk about is what we call the simplest of all the synovial joints. And our examples of those are going to be the intercarpal and intertarsal joints. Where's that located? The wrist and the ankle. Wrist and the ankle. Wrist right here, ankle where your tarsal bones are located. There's going to be gliding joints. Those small little bones are allowed to glide over each other, giving those free range of motion, that gliding type motion of the wrists and the feet. It's the simplest synovial joint. Most famous of the examples will be the intercarpal and the intertarsal joints. Carpal refers to the wrist bones, tarsal refers to the foot bones. Anyone want to give naming those a try? You're going to learn them all inside and out. Scaphoid, lunate, triquetrium, pisiform, hamate, capitate, trapezoid, trapezium. You'll learn all those before. Well, you'll have those all memorized, so you're sick of hearing about them. But they love to ask those bones on your registry exam. All right, next one is our hinge joint. Why is it called a hinge joint? Because it looks very similar to a hinge, like on a door. Permits what we call flexion and extension movements only. Most famous examples would be the elbow and the knee. This is this action right here, guys. That hinge action, flexion and extension. Same with the leg, the knee, flexion and extension. It's a hinge joint.
That's the B, right, sir?
Say it again?
That's the B picture.
Correct, right here.
And
That's showing you the elbow. That's your humerus, your ulna, and your radius right there. But if you actually look closely at the bones, and we'll look at these much closer in Rad Pro 2, they actually look very similar to that of a hinge found on a door. Almost the exact same shape. Thus, that's what's called a hinge joint.
Just because a joint can do that motion doesn't make it a hinge joint, though, right?
Just because it can do the flexion and extension. Typically, your flexion and extension type joints would fall under the hinge joint category,
So-
but not all, like you're saying.
Okay.
Yeah. And some have multiple joint movements as well. And we're just doing these in a more general sense right now, but as we get through the further chapters, we'll start reclassifying these to all the different bones, and I'll show you where a lot of overlap occurs. Yeah. Okay, next we have the pivot joint. What do you think it does? It pivots. Thus it's called the pivot joint. Allows what we call a rotation around a single axis. Two of our most famous, well, our most famous would be the atlantoaxial joint, the C1, C2 joints. What's that? Let's do. Let's just say, no, Mr. Donahue, I have no idea what you're talking about. Whenever you do this action. I'm hoping that you're not exercising your pivot joint much right now. I want this joint to be exercised right now. Yeah, we understand. Well, that joke went nowhere. Man. Just so serious for.
I just hear the friend Chandler or Ross pivot. That's the only thing that's going through my head right now.
Pivot.
When they're
moving.
the couch.
Yeah.
Yes, yes. So we have multiple pivot joints throughout the body. Most famous once again would be that C1, C2 joint, also called the atlantoaxial joint. But there's also one right here between the humerus and the radius. Allows us to do this action right here, where I'm turning my arm. It's pivoting. Of course, we have more throughout the body. We can do that pivot motion with our legs, with our feet.
But you're punching.
So what do you mean by C1, C2 joint?
C1, C2, vertebrae C1, C2. So it's called atlantoaxial because the C1 is also called the atlas, C2 is also called the axis. Thus the atlantoaxial joint, or C1, C2 joint. Two very important bones, because if you break either of those bones, your head's gonna fall off your body.
C1C2 holds your neck, head.
It actually, yeah, it's what attaches your cranium to your neck. Your occipital bone, which is the back of the skull, attaches right here. These two little facets right here. So, important on keeping that head on your shoulders. Yes.
Is that named after the great god Atlas?
Yes, it is. Yes, it is. We're jumping all the way to Rad Pro 3. You ruined my picture, Miss
Oh,
Bonilla.
I'm sorry.
That's okay. Yes, it's named after the Greek god Atlas, because if you know Atlas from Greek mythology, he holds the earth on top of his shoulders. Same concept. You're holding your head on top of your shoulders. Yes. I guess the Axis is called the Axis because it was evil or something, like the Axis powers in World War II. I have no idea if there's any relation to that. That's just what popped in my head. Well, my jokes are just going really flat today.
It's
Yeah.
Monday.
It's Monday. That's our excuse.
Early.
All right, we have the ellipsoid joint that allows what we call flexion, extension, abduction, adduction, and circumduction. That's a bunch of them there. Allows that full range of motion on your wrist, guys. So the radiocarpal, ooh, mine's popping. The radiocarpal joint. I guess I got some arthritis going on. The radiocarpal wrist joint would be the most famous ellipsoid joint. So a little overlap there, because remember those carpal bones found in the same area are also those gliding joints. We're talking about the radiocarpal, that's the attachment of the radius to the carpal bones themselves. Allows me to do this circular motion, this waving motion. I can wave goodbye like this, this. That's our ellipsoid joints, ellipsoid joints. We also have ellipsoid joints in our fingers, our phalanges. Fingers, phalanges, digits, and the one thumb. So the thumb has a unique joint that we're going to talk about here next, I believe. Why is it called ellipsoid? Because an ellipses is like a circle.
What circle, sir?
Sorry?
What circle were you?
Love that. So circumduction is a circular motion.
So you, with the
Makes it
ellipsoid
make
joint, you can do
ellipsis.
circumduction.
Mm-hmm. Yes, you can. Now we have the saddle joint. Very unique because there's only one saddle joint in the human body. That is a test question if I ever heard one. There is one saddle joint in the entire body. That is the connection of the first digit or the thumb to this trapezium right here, which is a carpal bone. It's a carpo-metacarpal joint between the trapezium and the first metacarpal. Allows for that fully opposable thumb. As you know, your thumb is very, very flexible. You can go in all different types of directions. It's called a saddle joint because if you take those two joints and put them together, they look like two saddles coming together. You can kind of see right here, saddle shapes. That is the thumb connecting to that trapezium, correct? Or what we'll say as far as joints, the carpo-metacarpal joints between the trapezium and the first metacarpal. Metacarpal is this area you see right here. Here's your thumb, here's the metacarpal, and then there's that trapezium that connects right there. So two saddles connecting together, helps with that fully opposable thumb. There's only one in the body, that is the only saddle joint. I guess I only have two saddle joints, but it's the only saddle joint in the body. And then, of course, there's that ball and socket joint that we just talked about. Why is it called that? Because it looks like a ball going into a socket. It allows for that widest range of motion. Your two most famous examples would be your hip. The hip would be the femur connecting to the pelvis, and your shoulder, the humerus connecting to the scapula. Those are ball and socket joint. Also sometimes called a spheroidal joint. If you want to write that down. Spheroidal joint. It's shaped like a sphere. What was the other name? The spheroidal joint.
Ball and socket joint, those got the
Yes, spheroidal would be an alternate name that sometimes they throw at you. Spheroidal, S-P-H-E-R-O-I-D-A-L. Did I say it too fast? Get it? S-P-H-E-R-O-I-D-A-L. All right, so let's review. Which of the following joint classifications is what we call slightly movable? Or
A.
one answer, A, you're correct. A for amphi arthrosis is going to be our semi-movable. Let's define the other ones. What's synarthrodial mean? Or synarthrosis?
Immovable.
Immovable or non-movable. Diarthrosis would be freely movable, and synovial would just basically be a classification of those joints we just went over that allow all those free ranges of motion. It's characterized by a joint capsule filled with synovial fluid. All the following are types of synovial joints, except which one doesn't fit? Correct, B. You can say it louder. Don't be shy. It's okay if you get it wrong. We're not gonna pick on you. I promise. B. Syndesmosis. The other three would be examples of synovial joints. Now let's go ahead and break those down though. Ellipsoid. What's an example of an ellipsoid joint?
Fingers.
Fingers or what else?
Wrist.
Wrist. Very good. How about a gliding joint? Also in the wrist, but where else?
The foot.
And the feet. And how about a pivot joint?
The hips. C1, C2.
Not the
Oh,
neck.
yeah.
Atlantic.
Oh,
Or
no,
Atlanto.
yes.
The neck.
C1,
Neck
C2.
C1, C2. Atlanto-occipital joints. Very good. Very good. So once again, study technique, guys. As you study things, look at all your answers, define all your answer choices, because you'll likely see that in another question in your tests. All right, where are we at on time? All right, it's coffee break time, guys. It's almost 9 o'clock. Go ahead and take 10 minutes. Come back at 9:07.